Welcome. Today I'm going to talk about some of the Felson's principles of radiology, especially when looking at chest x-rays. So one of the first few things that you want to look at is the area under the diaphragm. So you look at the area under the diaphragm to make sure there's no air or free air under the diaphragm. And you want to look at the shape of the diaphragms as well, as a flattened diaphragm may indicate hyperinflation. In this case, the diaphragms appear within normal limits. The next thing you want to look at as well is the angle of the costophrenic areas, and you just want to make sure that they're both visible on both sides. The next step is to look at the soft tissue and the bony prominences. So just make sure the ribs they don't look out of place, there are no abnormal breaks and fractures, subacute emphysema, and so on. Look at the clavicles and so on. So you kind of make your way up and around and down this way. The next step is to look at the mediastinum. Now you look at the mediastinum, you want to make sure that the trachea is midline. You want to make sure that the area that the clavicles come together puts the patient at least facing front so that everything looks appropriate. You're looking down the mediastinum as well, making sure the hard borders look appropriate, the hilum is located appropriately, and it doesn't look like there's a prominence of the hilar region. The next thing you want to look at then is looking for any signs of any other instrumentation, cannulations, devices, and so on, whether it's a pacemaker device, whether it's an ET tube, whether it's a central line, a subclavian IV line, and so on, and looking for signs of previous history of cabbages in these patients as well, along with valves or heart valve replacements. So once you look at that, or you're done looking at that, then you start making your way towards the lungs. So you zigzag, crisscross right across over here, just making sure that there's no abnormal opacifications, nodules, and so on. Take closer look at the areas where the ribs overlap, just because in that areas as well you may have something falsely hidden. The areas of the superior aspects of the lungs as well, there are many structures that cross over there, so that may hide either a nodule and so on. So you want to take note of that. So once you've crisscrossed both sides, then you compare both sides. So if you find something here that's normal, you want to make sure it's not here as well, because chances are that something that's pathological won't be equal and symmetrical on both sides. So that's basically the principles of radiology by Felson's. So just to kind of recap it, you want to look away from the lungs first, because chances are you're going to be drawn towards the lungs at some point. So you want to look at everything else so you don't miss on anything major. So you start under the diaphragms, then you go around soft tissue and any bony prominences. You come down through the mediastinum, looking at the hard borders in the mediastinum. Then you want to look for any invasive devices that may come into the chest x-ray, followed up with one area of the lung compared to the other area of the lung, and you compare both sides. Thank you.